It is yet another episode of Health Diary. My name is Gladys Gashanja, and today we're coming to you from the Westwood Hotel here in Nairobi. Now, this kind of cancer has highly been associated with older people, but more and more younger people are being diagnosed with it today. I'm talking about colorectal cancer. In mid-2019, if you remember, Kenya lost 2 legislators to this highly preventable and treatable cancer. So today we find out why oncologists are saying there is a high relationship between your lifestyle and the high numbers we are seeing that are associated to colorectal cancer. More on this coming right up after this fact of the matter. Colorectal cancer, also known as bowel cancer, colon cancer, or rectal cancer, is any cancer that affects the colon and the rectum. Colorectal cancer is one of the most common cancer worldwide and is easily preventable by routine screening. According to the 2018 World Health Organization report, colorectal cancer is the 3rd most common cancer in Kenya. Many people with colon cancer experience no symptoms in the early stages of the disease, and surgery is the most common treatment and may result to a patient using a colostomy bag, which plays the role of the rectum.
I'll go with my wife out, we'll eat something, I'll have a stomach problem. And my wife will tell me, Daddy, but many men don't need to have this. Go to and see a doctor. Then I'll go to a physician, check. No, it's gas. One of my brothers came and told me, John, that stomach of yours should be checked, because I went to the washroom and I saw a lot of blood in my stool. Immediately you see blood in your stool, a lot of it. Take caution. So I went to see a gastrologist. I went for a colonoscopy, I did a CT scan, confirmed that I had colon cancer stage 2 going to stage 3. My journey started in India, in a hospital in India called BLK. I was there for 2 months, where I was supposed to do 2 surgeries, but I ended up doing 3. Something like colorectal cancer is not supposed to kill, because it comes. It's in a part that you can stay with. I've not been having a colon for the last 6 years, and I'm still surviving. We have been doing a surveillance on the colon cancer every 6 months, doing a colonoscopy and endoscopy until early last year, that is 2019, when we detected again there was rectal cancer. So we had to do another surgery that was done in May 2019, which was successful. So now I'm cancer free. The doctors in India told my wife that I live only for 6 months. So according to the doctors in India, I was supposed to live until 2014 July. But because God is good, He has given me life, and here I am. 5-6 years almost going down the line. After the 6 months, it has become 6 years, so God is good. Cancer is really a challenge financially. I will still go a bit on NHIF, because when I was in India, NHIF did not do anything for me. The best thing I'll tell anybody going through cancer, trust in God, don't lose hope, keep fighting. Many have done it. We are here. We are many, in fact, fighting, and we are still soldiering on, and we know that God is with us.
So our conversation today, colorectal cancer, and to help us understand this cancer much better with us, we have Dr. Andrew Odhiambo, who is a medical oncologist, and of course we have Violet Kavele Shunza, who is a colon cancer survivor. Thank you for making time. Dr. Ri, I'll start with you. Colorectal cancer is any cancer that affects the colon and the rectum. How exactly does that occur?
I think it's important for you to understand, first of all, what the colon and the rectum are. So this is the organ that's responsible for part of the later stages of digestion, where all the nutrients have been absorbed, and then whatever comes out as feces is what the body doesn't need. So the colon is actually quite separate from the rectum. So if and when your colon develops a tumor, then we call that colorectal cancer, just to lump them all together. But for us, the oncologists, we like to separate colon cancer from rectal cancer because they have different ways of approaching the diagnosis and actually treating them. And before the cancer develops, usually you'll have had early changes for a very long time. And this stresses the point of screening.
Does that mean you can actually have cancer of the colon and it doesn't get to the rectum and vice versa?
Yes.
Now, they say colorectal cancer is one of the most common cancer worldwide, and in Kenya it's the third most common cancer. What informs the prevalence?
So if you look at it from a global perspective, cancers of the entire intestinal system, all the way from the esophagus to the stomach to the colon, are on the rise in this part of the world. And that's why there's a lot of research going into whatever we are ingesting, whatever we are consuming for a long term. Because we used to think it's just the alcohol and tobacco and whatnot, but that doesn't explain why somebody who's 17, young patients in their 20s, early 30s, who haven't had long-term exposure to the common carcinogens are still getting the same cancers. I think it's boiling down to what we are actually consuming.
Now, Violet, even as we talk about this, you say you were diagnosed at 33?
At 30.
At 30?
Yeah, I just turned 30.
So this is 3 years ago. What were the symptoms you had?
The symptoms started in early 2012. But every time I went to hospital, I was treated for different kind of ailments, ulcers, constipation, bloating and stuff like that. But the main symptom was blood in my stool. Every time I passed stool, there was blood in the stool.
Yeah.
And then towards 2016, 2017, my stool was very slim. And at times I could not even pass stool without the use of stool softeners. I had to buy softeners to soften the stool so I can pass the stool with ease.
Okay, now Daktari, just reading up on some of those symptoms associated to colorectal cancer, they mimic other conditions. So what about colorectal cancer stands out?
Allow me to confidently say nothing, because she's very right. Based on your symptoms, it looks like it was a left-sided tumor, because those are the ones that you'll actually see blood in stool. But if your cancer is on the right side, you will never see any blood in stool, because it takes a lot of time to transit from the right side of the colon to the left. So there are many other common conditions that give you blood in stool, hemorrhoids and so many other conditions of the rectum. So the key take-home message is repeated treatment of the same thing should arouse suspicion. A frustrated patient will go to hospital A, will be given medication for H. pylori, will not get better. They will not go back to that hospital. They will go to another hospital and start a different process again. And then when the history is not taken very well, that previous history doesn't come out. So you end up being treated now for typhoid, and then you go to another hospital and now it's amoebiasis. Before everybody ties up the problem, it's already too late.
At what point led them to that realization that they were dealing with cancer?
A CT scan was done, ultrasound and blood tests, urine test, and the doctor said I had pelvic abscess. So they said I was supposed to go to theatre and then they would clear the abscess. So when I went into theatre, when they opened me up, they realized it was not actually pelvic abscess. It was colonic mass.
On a personal level, how long should these kind of symptoms persist for me to now go and say, no, we need to look beyond what we've been treating?
If you are constipated or you're having problems going for a long haul and you've been treated, this week you've been treated, next week you've been treated, and it's not getting better, at the 4th week, you need to demand to have a second opinion or to be referred to a specialist who can actually find out the problem or is well trained enough to find out the problem. But I'll give you the other side of the story. Patients are scared of being diagnosed with cancer, and therefore when they are told you have amoeba, then that's a good diagnosis to have. So they lean on it and clinch on it because it's treatable and it's not cancer. So we both have to be educated, both the healthcare system and also the patients, because if you get an early colon cancer stage 1, with surgery alone, more than 95% of the patients can be cured.
And at what point now were you told you had colon cancer, and how did you take that news?
When I went into theatre, the gynecological surgeons were the ones who were operating on me. But from what I got from them, when they opened me up and they got that colonic mass, they had to call in the general surgeon who had to finish up the operation. When I came from theatre and I looked at myself and I saw my colon hanging outside my stomach, I was shocked. So they told me what they had done to me. We opened you up, we found a mass, and we are sending them the biopsy to the laboratory for further investigation. So I had to wait for like 2 weeks, and when the results came, they told me it's actually cancer. I can't say I was shocked. What shocked me most was having a colostomy.
Is there anything that you can say is probably fitting to the numbers of the younger people? Because this is a young phase in as far as this cancer is concerned.
Our part of the world, the research we've done at the University of Nairobi shows that this average age is 10 years younger. So our patients are getting diagnosed on average in their mid-50s. Now, we looked at a series of close to 500 patients just recently, and 20% of them are below the age of 40. That is not a small number. There's this new entity called, young onset colorectal cancer and also young onset gastric cancer. So these are GI cancers that are affecting a particularly younger population, but we don't know why they're getting these cancers. They don't seem to have any family history. They are not consuming alcohol. They are not consuming tobacco. So we don't know. For cancers that affect the left side, they're thought to be more common in men, but also women can get them. But the ones on the right probably tend to have a worse outcome in terms of prognosis.
Violet, speaking of risk factors, do you have any cancer in your family line?
I was the first one to be diagnosed with cancer in my family, and then my mom last year.
And what was your mom diagnosed with?
Multiple myeloma.
Uh-huh.
It's
So,
blood cancer.
okay.
Yeah.
Just about 10% or less of all colon cancers are linked to somebody in your family having it. We call it familial. Most of them just occur as you continue to grow up in life. We call them sporadic cancers. But having said that, the moment you have a family member who's diagnosed with colon cancer below the age of 50, then your siblings, parents, or anybody who is related to you directly needs to go for earlier screening. The current Kenya screening guidelines recommend screening from the age of 40. But in your case, then your relatives have to start earlier, probably in their 20s, because you were diagnosed when you were 30.
All right, so Dr. is talking about screening is the way to catch this kind of cancer early enough. But the question is, what kind of screening is there for colorectal cancer, and why don't we see this kind of messaging encouraging the same? This question will be answered and many others right after this break. Thank you for staying with Health Diary. My name is Gladys Gashanja, and of course we still have Dr. Andrew Odhiambo, who is a medical oncologist, and Violet Kavele Shunza, who is a survivor of colorectal cancer, to be specific, colon cancer. And before we went to break, Dr. Ari, you were insisting that screening is the way to go for you to catch colorectal cancer. What kind of screening are you talking about?
Screening means looking for a disease in somebody who is not sick. No symptom whatsoever. Once you already start to have bleeding or constipation, you no longer fall in the screening category. You fall in the category of getting a diagnosis. If you have no family history of colon cancer in your family, then what is recommended is the stool test. And this stool test, what it does is it looks for small traces of DNA that are released by very early cancer, which can be detected in that stool test. Now, if you have a family history of colon cancer, then you need to do a better test than the stool test. For those category of patients, we recommend that they go for a colonoscopy, which is just a hard way of saying putting a camera up your bottom to look into the colon, the entire colon, to see whether you have cancer or any growths we call polyps, which might eventually turn into cancer. How frequently you should do it will depend on the result of that colonoscopy. So it's not a yearly thing. Once every 5 years, sometimes once every 10 years is good enough, but it also depends on your risk. A stage 1 or 2 colon cancer can be treated with surgery alone. Once you move to stage 3, you will require chemotherapy, which costs quite a bit of money. And if you're diagnosed with stage 4, then it's very difficult to cure you, and you'll end up spending 10 times the amount of money that you would spend to do the screening test.
Yours was discovered at stage
2.
And you said you underwent surgery, so that means
chemotherapy.
And chemotherapy.
Yes, we did.
Okay, how many sessions?
12 sessions.
Yes. And after that, they declared you free of it.
Yes.
Let's talk about the bag you have to walk around with. You said you woke up and it was a shocker to have to live with it. What exactly does it help you with?
It helps me to pass stool.
Stool and urine, or just stool?
No, just stool.
Okay, and you have to change it on a daily basis?
It depends with the kind of bag I'm wearing. Yeah. So for closed bags, I have to change them on a daily basis. But for open bags, you only have to dispose, to drain, and then you can still wear it.
I think the stigma around either the diagnosis or even the treatment of the same goes a long way in probably being an obstacle to treatment or even early diagnosis. For example, the bag we're talking about, and also like colonoscopy. The procedure itself is very invasive.
Not really, because you'll be like half asleep, so you won't have the sensation of the camera going up. So probably the only distressing part of the procedure is that before it's done, you'll have to take some medication to empty your bowels, which is very distressing because you'll have to stay in the toilet for quite a bit to empty everything. But the actual procedure is a very quick procedure. If there's not a lot of things to look out for, in a few minutes, 15, 20 minutes, the doctor is done. Not everybody requires the colostomy bag. It depends on where your tumor is located. If your tumor is very big and it's on the left side and it's probably much lower, such that you cannot have a successful surgery without interfering with certain structures, then you will require the permanent colostomy. Some patients only have a temporary colostomy, meaning after some time you can go for reconnection. But if you have a very low tumor and they have to take out most of the structures in the pelvis, then you're left with this bag, which becomes your natural way of passing stool. Some patients have no access to high quality bags, so they're just using nylon papers or like the coverings of like a loaf of bread. So it can be very distressing, but there are actually some very good bags out there that are very tight, that you can drain, as she said. And once you stick it, then there's no smell.
Okay, let's hear from somebody who has to live this reality. How have you coped with it?
Immediately after the surgery, I went into depression. I was not leaving the house. I would stay in the house the whole day. I was not eating, because the more you eat, the more you pass too. So I was not eating. And I think at that particular point, I was 33 or 35 kgs. And then it is until I met a survivor who has a colon bag that I started realizing, okay, it's not that bad. And eventually I got to meet many other people, around 300 people, and I realized I'm not the only one.
And you can actually not tell that you have it on. Yeah, which is pretty impressive, yeah? We talked about treatment. She talked about 12 sessions of chemotherapy. What other options are there in treating colorectal cancer?
Most patients who have either big tumors in stage 2, most of stage 3 and 4 patients will need chemotherapy. The only problem is the frequency tends to be quite short intervals, every 2 weeks, and then you have to be on treatment for a 6-month duration. And sometimes the cost of coming to hospital, going back, sometimes you have to be admitted, is what actually is the bother with the treatment. But those who complete very well and enter into a surveillance program every 3 months, we check their blood. Every so often we do their colonoscopy and their scans. Majority of them will do well, and many patients whom we've treated locally are living even 10, 20 years later, and they are pretty fine, because it's very straightforward what you need to do.
Talking about treatment, there's a cost to it.
Yes.
How did that look for you when you were going through the therapy?
It was very expensive, and at some point my dad had to sell his piece of land, and I had to do a fundraising. I had to set up a pay bill number to try and raise funds just to help me cater for the treatment. I had NHIF, but what NHIF does, like for me, I was to go for 12 sessions of chemotherapy, and NHIF could only pay part of the 6. And NHIF did not cater for blood tests, and every time you go for chemotherapy, your blood has to be tested, your immunity has to be tested, and all that.
And then there's a colon bag.
Yeah.
That also came from your pocket, right?
Yeah.
How often do you replace it?
It depends. At times you can even get out of the bathroom, and when you try to stick a bag on, it doesn't stick. So you just have to throw it away and try and stick on another one.
How much are they?
A good bag goes for 1,000 shillings.
It should actually be something free. For them, it's actually like a sanitary pad. They shouldn't be paying for these colostomy bags, because it's part of their dignity. It's like part of their clothing wear that they have to have all the time.
What's your message for those that are so afraid, thinking that a diagnosis means death?
If the cancer is detected early, that is equal to better treatment option. Like Daktari is saying, if it's caught at stage 1, you'll only go for surgery and go back home.
If you had a chance to do this all over again,
I would have asked my doctor to go for a colonoscopy in 2012. Yeah, when I started seeing blood in my stool.
Do we have the infrastructure in this country to cater for all these needs, and are they affordable?
We have the infrastructure for screening. Whether this is affordable to everyone is the question. For example, a colonoscopy in a public hospital is likely to cost somewhere around 8,000 Kenya shillings. NHIF is not very clear whether it's paying for screening or not. Again, people fear screening. I always use these words of Anthony Del Monte. Cancer has no face until it's yours or somebody you know. But I think the message needs to be louder. The National Cancer Institute needs to be empowered to make this message as loud as possible.
Okay, I think that is very imperative that we remember screening is a way to ensure that we keep colorectal cancer at bay. Dr. Andrew Odhiambo, medical oncologist. Violet, thank you for your time. She is a colon cancer survivor and a cancer ambassador, right?
Yeah.
Time now for the health tip.
Health tip brought to you by Good Life Pharmacy.
Today we are going to talk a little bit about skincare, and I'm just going to show you the 3 important steps that everyone should have. The most important thing, you need to cleanse your skin, and after cleansing it, you must moisturize, and then lastly, you must use the sunscreen. Most people think that if they have oily skin, they're not supposed to moisturize. Moisture is different from oil. So we have moisturizers that are oil-free, and are suitable for the oily skin. We have the brand La Roche-Posay. Comes in a cleanser, toner, moisturizer, and we also have things that are used specifically for eczema and atrophy skin. We also have our new baby, which is called Uriage, which is specifically and exclusively for Good Life Pharmacy. We have the baby range, we have the acne prone range, we have the pigmentation range, and also we have the sensitive range. For this and more products, you can visit any of our Good Life outlets countrywide.
Yet another informative episode of Health Diary. Thank you for your suggestions and comments coming through to us on our social media handles. My name is Gladys Gashanja, and today we are coming to you from the Westwood Hotel here in Nairobi. Until next time, see you. Colorectal cancer. Those ngoja kwanza nikajoto najaribu kusenta. I'm so cold today. Haya, sawa.